Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. So welcome everyone to the Transforming Healthcare Coaching Podcast. And we are super excited for this week with episode 51 to talk with Lauren Patrick, principal and founder of Prosperis Consulting. We're going to talk a bit about different practice models and what's out there in the healthcare profession. So Lauren, I was wondering if you'd like to introduce yourself to our audience.
I'd love to. Thank you for having me, Dr. Emlet. Such a pleasure to be with you. As you mentioned, I'm the founder of Prosperis Consulting, and what we do is we help independent medical practices to become more efficient and profitable. And in that vein, what we do a lot of is help with revenue cycle management. We help with practice operations. And we also do a lot with coaching and just helping to support practices who are ready to grow and scale, to have the systems, people, and processes in place to do that.
I have to admit, when you and I first met, I realized there is so much that I don't know. Because obviously, as a W-2 employed physician for a large academic center, I really had not been exposed to this entire world until I had started getting into physician entrepreneurship and obviously the coaching company to realize that there's a whole nother world for how many different people and places practice medicine. And so I'm wondering whether or not all of us in healthcare always think that the grass is always greener somewhere else.
Probably.
Especially because we always feel a little stuck in our current job. And then after we graduate from our training programs, we often take employed positions because we feel like it provides security, a really large infrastructure in terms of getting a patient base. And honestly, we aren't taught anything about business in any kind of healthcare profession. So in broad strokes, would you be willing to share about what are the different types of medical practices that you see out there in general?
Yes, absolutely. So there are 4 major types that we see out here. And those are as follows. So, number one, your independent medical practice. And that's what we kind of know and love as including the primary care practices that are independently owned, your independently owned urgent cares, specialty clinics, direct primary care. All of those really fit into what I'm terming the independent medical practice. And really, they're characterized by being run by either a solo physician or a small group of physicians. And those physicians have complete and total control over this practice. So, those I would say are probably the 50% of medical practices out there. And then the next big category are the hospital-owned medical practices, which are increasing in number. And I would say that those are about 20%. And this is where the hospital buys the medical practice so that they can keep those kind of doctor's offices and services in-house in the hospital. And those can be primary care, they can be specialty, they can be really any sort of medical practice. And really, the hospitals are doing this so that they can create more of these full service networks, again, in-house, and so that they can have control over patient referrals and the coordination of care and all of that. The next big category are the private equity owned practices. For those of you that are not aware, these would be the Minute Clinics that are owned by Aetna CVS. They are pediatric associates. Another example is dermatology associates. These are practices that, in many cases, the private equity firm has bundled dozens and dozens of individual practices into a group of practices in order to make them more efficient and profitable. They saw an opportunity to basically simplify the complexity that is the regular medical practice and bring management and profitability to these practices. So those are becoming more and more common, and I would say they're about 10% or so. And then the last kind of growing sector of medical practice that we're seeing is telehealth, the telehealth only, I should say, medical practice. And these are practices that are just completely virtual. They have no brick and mortar. This started a little bit before the pandemic, and then they grew and in popularity as well among patients. And they are continuing to grow. And again, they can be all manner of medical practices, whether mental health practices. We're seeing a lot in the direct primary care space, but again, virtual practices that are physician owned and operated, or in some cases, they can be hospital operated. So they really look all across the gamut, these practices that we're seeing. You can kind of mix and match.
And so if you were giving advice to a new graduate, a new physician, NP, PA, nurse to work in all these different types of practices, I'm curious from your perspective what advice you'd give because you see a bigger gamut across
Right.
more professions than I obviously do. So I'm really just super curious from your perspective, what tips or advice would you give in terms of how you evaluate what opportunity is the right one for you? Which one might resonate in different maybe career epochs of your life? Or maybe I'm mistaken in that. I don't know.
Well, my advice would be for someone coming out of medical school to really do some time in each of these various
Mm.
scenarios, these different practices, because they really require different skills and abilities. And owning a practice or having a physician who's kind of at the intersection where many of my clients are, where they're responsible for patient care, but they're also responsible to run a business, is a lot. And not everybody, as you mentioned, even though it does look like the grass is greener, not everybody is equipped to be able to handle not just the business acumen, but the leadership skills that are required. And quite frankly, the financial stress that is required to have a medical practice. So I would just say that you really need to do some soul searching and also just spend some time in some of these different medical practices to see if you have the temperament and skills to be able to thrive in the environment.
Yeah, that's such a great point. I think it's also really interesting how so much of the opportunities that are provided are all W-2 employed in very large, even the private equity owned practices, and how you negotiate that, and are there opportunities for growth professionally? And so the professional growth, no matter what discipline you are, is different, I think, in each of
It's
those
very
practice models. And I think that's the other challenging thing that people don't really realize when you're done. We've made you just barely competent enough to go out and know the medical stuff. There's just so much more that you don't know in terms of all of this, in terms of how healthcare is delivered. And there's a lot of anger, resentment. No matter where you sit, there's always this anger and frustration in terms of who's the root cause of all evil, I suppose, in terms of the business structuring of things. So I do think it's something that none of us do a really great job in terms of really trying to educate and be fair and not impartial, because for any one of us to know one way of practice, there's another colleague or graduate or someone that you train with who's trying out a different model. And so I think it's really super fascinating from your perspective that you sit and advise across all of these. You
right.
probably would say there is no one better way than the other. They're just different ways of practicing.
They're just different ways of practicing. Yes, exactly.
Yeah. And I mean, and I think you and I both know there are a lot of strong opinions about
Yeah.
certain things, about how different, who's in charge and where the locus of control is. And I think for different people, whether what your values are and what your mission is and what works for you will be different. And I think that's also okay.
For sure. It's interesting because what I find working with a lot of physicians who are working independently is one of the things that they never anticipated being in their own location is how somewhat isolating it can be from the community of physicians that exist in other areas. If you're working in a big hospital group, for example. And so they've got to be really proactive, education, training, networking, having that community. And these are just things that you just don't realize until you're in that situation.
Yeah, no, that's definitely true.
Yeah. So
It's
there's always pros and cons.
Yeah,
Yeah.
my uncle was a solopreneur pediatrician his entire career and only just sold the practice very recently, which is at age 80. It's like it's pretty amazing that this can still exist because I think every younger physician doesn't even realize this can exist still in this day and age. They don't even think these are actually options
Mhm.
and that survive. We've all seen Affordable Care Act. We've all seen different things come and go in terms of value-based care and things we throw around with the digital health. Like we've all seen these different trends happen, and yet we still have all these different ways of practicing it with the newest addition obviously being telehealth.
Yes.
And so I'm wondering,
Absolutely.
your ideal clients, how do they come to find you and how do you support them?
My clients come to me in multiple fashions. I'd say that half of them come via word of mouth. I am working with a colleague of theirs and that colleague has referred them to me. Or more and more they're coming to me from Google because everybody goes to Google for everything it seems nowadays. However, what is interesting is that almost universally they're coming to me to handle some sort of issue that they have in their revenue cycle. So, for example, I am struggling with getting paid by insurance. I cannot figure out why it seems like my payments are going down. I'm not doing anything differently, but I'm getting paid less. Can you please help me get to the bottom of it, investigate what is happening? In some cases, they just need help. Again, we work with a lot of solos and practices that are 10 providers and fewer, and they'll say, we just need help. We need help. We need help with prior authorizations. We need help with eligibility. Coding has changed. We cannot keep up with the latest changes. Sometimes they need help with training. Can you just train our front desk? Because again, there's a problem. We don't know exactly what's going on, but all we know is that we're getting a ton of denials. So whether it is, look, we need to investigate some sort of revenue piece or we need you to help train us, it's usually something impacting their revenue.
Yeah, that makes sense. And you probably would say that so much of this is so complicated.
Mhm.
It's so complicated in terms of getting the payment, the justification, and I guess I'm curious because of these payer mixes, like what are the payer mixes out there for healthcare? Whether is it from the continuum of preventative versus well-being and wellness versus sick care, the primary care, pediatric versus subspecialty care? Because like you said, I mean, the different subspecialists will also have different ways of practicing. Is it just that the
Mhm.
rules keep changing? Is that the only reason? Or is it that insurance companies really are a lot of the problem in terms of denial in the process of things that should work don't work. I'm just curious.
It's a combination of things. Number one, which you mentioned, is that the rules really do keep changing. There are actual coding guidelines and billing guidelines that change every 6 months like clockwork. So it is a moving target keeping up with those changes. But the other thing is also that these practices they're doing everything that they can to keep up with the changes, but it's just very hard if that is not your full-time job, to be honest. If you are not constantly watching and being vigilant, it's just very, very tricky. So the other thing that we're seeing too is that between the payers, there are also changes. So you mentioned payer mix, but that is actually a huge source of the complexity. When you're talking about private insurance, they will have one set of rules. Medicaid will have a completely set of different guidelines for what they will pay for, what they won't. So not only is the target constantly moving, but then the payers are also moving in a different direction as well. So it's a lot.
It sounds
I've seen where these practices have literally like sheets of paper on their desk, just trying to do everything they can to keep up with this.
so crazy, this trying to understand this. Are you seeing any new players coming out on the market with AI to help both parties? Because you would think that I mean, if you didn't have to have this in-between land of the justification, the explanation of the science and the decision between the patient and the provider, because I think this is where people get pretty angry that we often see on different social media outlets that between the patient and their surgeon, they have decided this is what needs to happen. And nobody can disagree with this. I mean, it follows all international guidelines. It's correct. And yet there's all this weird back end that everyone is now fighting. Sometimes right up until the very day of the scheduled procedure, which I mean doesn't nobody's helped by this in terms of having greater complexity. Are you seeing any other new AI or software or things to be able to help this relationship get easier?
I think there's a lot of energy right now in healthcare and particularly around AI, because this is, as you mentioned, just such a huge opportunity. I'm not seeing anyone really doing it well just yet, but this is super promising. And I think it's only a matter of time before we can include AI both on the provider side to help them do a better job in terms of figuring out what's paid, what's not, coding, and all of that. And hopefully, really being able to be a little bit more proactive in assisting staff to comprehend all of this stuff. But in terms of, again, a cohesive solution, I'm not seeing anything yet, but I'm super hopeful, and I think it's coming.
Yeah. Part of it is, I think, just having someone translate what we're doing, like, so we can just
Yeah.
operate in our zone of genius. And then on paper, whatever magical, like, language, the exact words you want me to say, I'm happy to say them. And I know when my queries come back, they're like, that's not the point. The point was actually for us to really just have a dialogue with you. I'm like, but you realize this feels very frustrating to me that you're now retroactively asking me something 3 months ago that I did or said that I now need to change the chart to make somebody else happy that wasn't even involved in that relationship. It's always a very hard retroactive. I'm really excited for a day where a robot can do it like in the moment,
Oh, goodness.
right? Like in the moment.
Me too. That I was going to mention, that's a very common question that I get too, where people call in and just be like, isn't there an AI tool that I can use that'll help me
Right.
do all this stuff?
Right. I know. So
Where is that tool?
yeah.
Yeah.
So for all those budding students out there who already have a
Yeah.
computer science engineering degree, which they exist, who are thinking about
This
going
is
to
what
medical school, you can just go to medical school and then go make your own company. Do it on the side right now because that would make everyone's lives easier. If we just in the moment had a quick query to clarify, is this what we really meant? And of course, like, yes, this is exactly what we meant. Thank you, Alexa, for rounds or Alexa for billing to make things a lot quicker in general.
Exactly. We will be naming buildings after you.
Right, exactly.
So, yeah.
Right.
So,
So I think with the greater diversification of these opportunities for healthcare professionals is actually a good thing because now there's more opportunities for independent practice, concierge primary care, concierge specialty care. I think that's like the fun new thing, the concierge rheumatology, for example. What are the most common challenges that independent practice owners face? Just so that we can go ahead and bust that myth right now. These are going to be the most common things you're going to find if you decide to go out on your own.
as I was mentioning, so many of the healthcare providers I work with say that we really went into private practice so that we could have more freedom, more time, more control over our lives. And what ends up happening is that is not always the case. Again, because people have underestimated the level of skill and knowledge and time and resource that it takes to have a private practice. And so I would just say that not having the training on how to actually start the business and then manage it and then eventually grow it, each in itself, which are different skills, is something that we see really overwhelming a lot of healthcare providers. So, and for some who are not able to figure it out, instead of it being this like source of freedom and this ends up being sort of their nest egg and all of that, they feel very stuck in it. And it is not always something that they can overcome, that just sense of stuckness. So that is one piece of it.
Yeah, and so I think I've noticed that the direct primary care groups tend to network at least regionally or maybe even larger than that, to be able to provide the information necessary to help support
Mhm.
people in that educational journey and growth and scaling, like you said. Are companies like yourselves, like, is it can people just find a partner to be and, like, just we're just gonna structure the business differently from the get-go and have someone like yourself and your company come in to help? Or is it something that doesn't exist that way?
Absolutely. That is something that we're very focused on doing in my practice. I think i- in some practices, again, some of the solos and the smaller ones where they just may not have as much access to some of these networks and education as, for example, you mentioned the DPCs that are really energized about resources and such. So we're trying to kind of step in there and be really proactive about like, here is the support. Here's where you can find us. We're here to help. This is what we do. Yes.
That's awesome. What are the real issues that you're seeing with the private equity owning and taking over private practice groups?
I won't make it sound like there's not any positives from private equity coming in. There are certainly nothing is necessarily all bad. A lot of the physicians I work with have said, "What? We've got cutting edge technology.
Mm,
The practices are very, very efficiently run. We're paid very, very well." So there are certainly like some pros. We'd be remiss if we didn't acknowledge that there are pros there. But on the con side, the thing that I am still hearing all the time is that there really is a focus of profit over patient still. And so what that looks like is the physician productivity being managed down to, I mean, the nth level of detail, where you're going over physician profitability. Why is it less this month versus last
mm,
month? How can we get it back up? Do we need to order more tests? What procedures can we do? I mean, all of this, like just a heightened focus on the highest levels of productivity. Sometimes, I won't say at the detriment of the patient, but before being prioritized over the patient. So that's something that still needs to be looked at for sure. And all of that, they are saying, leads to burnout
mhm,
and just stress because you're just really trying to keep up with these targets. From the patient side, I would say that a couple of things are happening. One is that with private equity consolidating a lot of these practices, it means that there's not as much competition. And so what that does is it drives cost up. So we were looking just a couple of weeks ago at a gastroenterology practice, I believe it was. And what happened after it was absorbed into the private equity group was that the costs actually went up for a colonoscopy. So just again, that's something that if you're a patient and you have excellent insurance, maybe you're not impacted, but if you have a high deductible plan or maybe something else going on with your insurance, this starts to be a burden when you're in an area where you have practices such as these and less options for where you can get your care. So that's something to be mindful of. I think the other thing too is that, and again, this is more from the patient side that we've heard, is that it's less personal. It can be less personal because again, an unintended consequence, but when you're trying to streamline costs and you're bringing the appointments down from 20 minutes to 10 minutes and telling these doctors they've got to kind of go through these appointments, patient can feel rushed. And in fact, that is what they say, that they feel rushed and that it's just not as personal as it would be if, say, they were coming to see your uncle as an example, and they can take their time, have the proper conversation. There's nobody really tracking it. So pros and cons again.
Yeah, no, that makes sense. I think we definitely have seen all of those things that you've mentioned. I'm wondering, how does value-based care and the desire for value-based care sort of play out in all of these different models?
Well, it's interesting because I think these firms are taking it seriously in terms of tracking, or at least they're saying that they're tracking the different metrics of patient care and such. So I do believe that there's a concerted effort to do that. But again, from the actual value part, that I think is still a target that is not being hit.
Yeah, and I think the hard thing is I don't know that anyone necessarily knows really value from whose perspective.
Yeah, value. Yeah, exactly.
Right.
It's not cost of care.
No.
That is not being hit. Yes,
Right. Yeah. And I think the only person who really matters the most is probably the patient, what they think.
truly.
Yeah. And so I'm wondering, so as we come to a close with our podcast this episode, what are some advice and tips that you'd leave our audience with in terms of as they just try to decide, well, where do they want to practice and how might they see their own personal learning and journey and growth over the lifetime of their career and all this diversity of where they can experience things? What would you like to share?
Yes. Well, I would just really mention that one of the things that I've observed is that clinical expertise, while of course critical, is not the same as leadership. And so, as healthcare providers are considering going into their own business, be an entrepreneur, whatever that looks like for them, that they really need to consider building leadership skills. What I mean by that, because it's just so crucial in medical practices, particularly when we're talking about hiring staff, which is going to be necessary if they're going into an independent arrangement, conflict resolution, learning how to delegate. All of these aspects really center around your leadership skills in building those. So I would just say for physicians who are interested in going that route, that you take the proper time to build those skills in addition to the clinical expertise.
Yeah, it's a really great point. I really appreciate your sharing that. It's really interesting how everybody is a leader. Like, so in our energy leadership coaching, we really talk about the fact that everybody leads in their own life. And so that's part of the problem whenever you feel there's something not right, whether in your relationships, your work relationship with your boss, or you want to go into a new venture. Almost always it's like, how are you showing up in these opportunities of these different team or individual relationships as you're moving forward in life, and also even with yourself. A lot of times people don't even lead very well in their own lives. So it's really about getting to the heart of things. So I think in that respect, we're super aligned.
Yeah,
Yeah. So how can
definitely.
people find you and how can people work with you? And tell us all about how they can reach you.
Well, please find me on via my website, www.prosperisconsulting.com. And you can just the number there for you to reach out to me or schedule an appointment, and we'd be happy to speak to you.
Awesome. Thank you so much for coming on our podcast. I know a lot of people out
you.
there in private group, private practice, we all want more revenue and optimization. And sometimes just getting an analysis is vitally important. So for everyone listening, thanks so much for staying tuned. And please like, share, and subscribe. I know for a lot of people, you're in a journey of transition for yourself and transformation of where you're growing in your own personal career in healthcare. So please like, share, and follow, and share with a friend who might be in need of some advice and or would like to hear about what Lauren's company can do. Thanks everybody for listening. Bye-bye. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call, free, at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.